So this is Kyumbini Primary School, one of the schools that I work. It is one of the most popular school. It has over 100 pupils. And the activities that we do, which we do together with the community, is that we address sanitation issues, we address water issues. This is an area which is semi-arid, and water is a big problem. So the project has so far done work with this school. We have supplied 4 tanks, 16,000 liters. The pupils, when they come to school, they don't carry the jerry cans. They are now at least healthier, because when they come to school, before the project, when they used to come to school, they've been asked to bring water. If you don't bring the water, the teacher will tell you, go back and bring the water. So there's all that disturbance. The disturbance is no longer experienced now. The sanitation issue is also one of the biggest challenges in this country. You find that most of the latrines in the schools usually collapse because of poor construction, and the parents have very minimal income, and therefore they construct very semi-permanent structures. The project has been able to support in that area in Kyumbini, and we have been able to bring up some very permanent structures for the sanitation, for the latrines. Now, I would also say that with this work, it has been very motivating to see the cooperation of the community members. They have been able to supply all the local materials that are required, the sand, the bricks, the manual labor. They work with this artisan so that now the work, we don't have to pay for the manual labor. So the school parents provide that. And that has been very good. In this school, we did the work within 6 months. We were able to bring up the latrines. And so I enjoyed working here, and it has been very motivating even to see the change that has happened with the pupils. And so not only did we support with the construction of the sanitation facilities and the rainwater harvesting, but also engaging the students, the pupils, with skills on hygiene. Training them on hand washing. And so that has been also very key, and we can now see the change that has happened to the pupils. And that message that is usually in the school trickles down to the communities, because they go back to their homes, because we believe that these little children are agents of change. They have been able to take that message to the communities. We meet at the community level to sensitize them about having a latrine, at least a latrine in their homes. In future, I'm seeing a community that is healthier. Those habits will are continuing, even spilling over from one household to the other. These hygiene practices are spilling over from one primary school to another when they visit the school. Like here in Kyumbini, where we are, it is a center of 13 other primary schools that come here for sports. When they come and see the hand washing stations, they see the pupils practicing good hygiene, they take those habits, those practices, and practice them in their own places. And therefore, there is that spillover effect. And again, people usually look at our project and they see how we are addressing the basic things for life, for well-being. They look at our project and they go home, trying to understand that this is the way to go, because it's about disease prevention, especially when it comes to hand washing, wearing shoes for the kids, having a latrine and using it properly, and then we explain to them, the Ministry of Health officials, they come and sensitize them on how diseases are spread. And members of this community are they look at them and say, yes, this is it. We've just been ignorant. We've just been doing things without knowing that they are bringing effect to our health. So for me, it's going to be lifetime effect for people, because when they start practicing this, it becomes their way of life. Then they are healthy. They will save money on medical bills. They will save money and be able to do other things.